Well, welcome to Potomac Rejuvenation Center. Physician Rejuvenation Center is our old name. You can reach us at www.prcndc.com. I hope you can read that there. Basically, the subject matter that we're going to talk about for the next 7 to 10 minutes is bioidentical hormone replacement therapy. The issue of bioidentical hormone replacement therapy is one that comes with a little bit of confusion. The very name bioidentical, that means it's biologically identical to the hormone that you have in your body. And so, it takes a little bit of, understanding, because people need to understand that bioidentical hormones are different than the patented synthetic medications that you get from, the local drugstore. Bioidentical hormones are made, which is called compounding, by your local pharmacist. So, bioidentical hormone replacement therapy is a special program by specially trained practitioners, physicians, nurse practitioners, your PA, that have trained in this area, that have specialized to be able to work with a compounding pharmacist to do this. So here is a picture of the triad of what you need. You need a well-educated practitioner that understands bioidenticals. You need a pharmacist that makes them, as well as understands how to give prescribing guidelines to a practitioner that's kind of new at it, that hasn't been doing it for years. They need to be able to get advice or certain direction in terms of the best cream or a delivery vehicle to use. Once you have this base, this is your foundation, the practitioner and pharmacist. Once that relationship is established, then you can start adding patients up here at the top. Then the patient comes in, and you'll have a successful practice. You'll have an ability, the knowledge base, and ability to get the compounded medicines to the patient to meet their need. So I think that that's important. Anytime that you're talking about bioidenticals, you have to have a relationship with other practitioners in order to be able to have a successful practice and to be able to successfully assess, diagnose, and treat the underlying disease conditions that would need a compounded medication. And in terms of this, we're specifically speaking of bioidentical hormone replacement therapy. But compounding pharmacists, there's lots of other stuff that's compounded. That's great. If you're on serotonin selective reuptake inhibitors or the norepinephrine uptake inhibitors or the serotonin selective norepinephrine reuptake, some of these things, you can get off of those because some of those have a very high toxic profile, and you can go to more natural things that are compounded that are actually delivered in a much better way and that are much more effective. You can do that through compounding. So I think that's a really nice option. And I just wanted to go over a basic understanding of compounding so that you'll understand that bioidenticals are something that must be done with a well-educated pharmacist or good pharmacy staff. And that is to be between the practitioner and the pharmacist. We have that here at PRC in DC. We have several different compounding pharmacies. I myself have been doing BHRT for over 5 years, and I've worked in a clinic for over 4 months. It went through a program just to learn how to do the women. And it's hundreds of hours of study that must be done, and you must see several hundred women in the setting with somebody that's been doing it for years to be able to know how to work with women to use bioidenticals. Men, it's a little bit easier. It's not that complex, but there are certain little nuances that you must know. Anyway, so let's go on here. The next issue is hormones. So we're going to go over that briefly here. A hormone, basically, it's something that's secreted by endocrine glands. It's a gland that secretes into the bloodstream a hormone. And basically, hormone means to set in motion. It goes onto a receptor, sometimes on the outside of cells. A lot of the steroidal hormones can actually stimulate the outside cell, but they can also go through the cell. The cells are able to allow them to pass through quite easily without using any energy, and then they can hit receptors on the inside, just on the inside of the cell, or they can go to some of the nuclear areas, so on and so forth. But basically, that's what they do. Whether they go on the outside of the cell, or they hit a receptor just on the inside, or whether they actually go to some of the nuclear areas in the cytosol, or and stimulate or tell the cell. Ultimately, the cell will transcribe DNA and make certain proteins or other things to be able to peptides to send out messages to get a clinical effect, such as a thyroid. The thyroid will tell the cell, hey, make X, Y, and Z to increase metabolism, to increase, enzymatic reaction. When the enzymatic reactions, when they go up, of course, heat is a byproduct, and therefore the metabolism increases, and with it, heat. And heat is, really, it's one of the best indicators of thyroid function. So just to give you an example of that, we're going to be talking about testosterone for men, estrogen, progesterone for women in terms of the sex hormones. But I just used the heat and the thyroid hormone, T4, T3. T3 is a bioactive, as an example of the end effect of the thyroid hormone being increasing heat and enzymatic activity. So they're powerful. These are very minute substances, and they are not secreted in a large quantity. So bioidentical hormones are hormones that have the exact chemical structure as human hormones. Okay, so they have the exact chemical structure. Synthetic hormones do not. So, for example, synthetic estrogen and synthetic progestins, which it's hard to call them progesterones because they're not, or a form of progesterone. It's really even hard to classify them in the same category. Some of these things can have 20 and 30 plus year half-lives, meaning they get trapped in certain tissues. They get ionized in certain tissues because those tissues have a different pKa, a different pH, and they stay there, for half your lifetime. And if you have a tissue that continues to build up, if you have a tissue that continues to get toxic of a certain hormone, and women, breast tissue will, if you are taking synthetic hormone, whether it be one of the, medroxy, progesterone acetate, or one of the many different types of estrogen, what do you think is going to happen to that tissue when it's been, just building and building and building super physiologic levels of a hormone? To me, I start thinking cancer. But with bioidenticals, your body's going to detoxify it just as it would your own hormone that you naturally make. So it's kind of intuitive. What would you rather have in your body? And I just want to put this next slide in black and white, so it's very clear and very plain for you. Bioidentical hormone replacement or bioidentical replacement. You have certain characteristics that are the benefit of why you're going to take it. They are common sense physiologic reasons. Okay, the half-life is the same, so it's going to stay in your body. It's going to be processed in your body the same as the natural hormone you make. And that's a benefit. That's a plus. It's not going to ionize, go into your tissue for 20, 30, and even longer. Decades. Okay, it's not going to do that. So there's really no toxic profile. Is that clear? It's going to have the same profile that your body would naturally have because it's identical to the hormone that you're making. And then if you are susceptible to your natural hormones when you're going through puberty and you got certain androgenic type symptoms such as acne, bioidentical hormones have very, very low cases of that. So if you're talking about side effect, the profile on the side effects are very low, such as like acne. It's very, very rare. With bioidentical hormones, you have excellent tissue saturation, meaning it's going to be in the tissues and it's going to hit 100% of the cell receptors. No synthetic drug hits 100% of the receptors. It can hit most of the tissues and most of the receptors, but not all of the tissues and not all of the receptors for synthetics. Whereas you get 100% identical. It's identical as you would normally in your body. So there's, I think that's an important benefit to get. So I put up here very plainly, why be a chemistry experiment, and not go natural? Why would you want to take a synthetic drug? Listen, I am not poo-pooing synthetic drugs. No, if you need to take one, do it. But just realize that if there's an alternative that's safer, that's natural, that's identical to what you would normally have, I think that it's intuitive, or common sense would dictate, or common physiologic sense would dictate that doing a bioidentical or more natural thing would suffice. So let's take a look at the bioidentical hormones. It is a prescription ingredient. It's not over the counter, such as herbs. It's purchased from an FDA-approved repackaging facility. In terms of bulk, in bulk, it's FDA repackaging facility. The pharmacists get it from. It is then compounded into a prescription by order of a licensed practitioner. MDs, DOs, NPs, PAs, your typical, allopathic practitioner. A lot of in the states where NDs are allowed to prescribe, you're seeing they are prescribing bioidenticals. They are big into that as well, and it's regulated by the Board of Pharmacy, by the state. It's typically not under federal guidelines, which is a good thing. You don't need a myriad and layers and layers and layers and layers of regulation. Okay, it's very simple to produce natural, healthy creams to be applied to your skin, and then that's what most bioidentical hormones. That's the typical route. So, just to give you an overview on bioidenticals. How many large randomized clinical trials have been done on bioidentical hormone replacement therapy? The answer is none. And that's probably why a lot of physicians, and a lot of the medical associations are not pushing bioidenticals. They're not patented, so the drug companies are not going to be in a relationship with the various medical associations to encourage their use. Because they're not patentable medicines. So there is no patent on these things. So you're not going to have people spending money to do trials on it. The government's not going to do it. Private industry's not going to do it. So who's going to do it? These are naturally occurring substances. They can't be patented. So there's really no incentive to do a study. There's a wide dosage variance. One woman might need a 0.06 milligrams of estrogen, and another might need a 1.0, or 0.1, or it just really depends. There's lots of different indications. One woman might need 20 milligrams of progesterone to 0.06 of estrogen, and another might need 0.1 of estrogen and 25 milligrams of progesterone, and they might need it on different days. Some women might need it on days 10 through 27, and some women might need it on days 7 through 27. It really depends. So it's cyclical. There's different dosages. There's a lot of complex stuff with women, especially with the progesterone and estrogen, the bioidentical to human hormone that we use for them. So doing a study would be a nightmare. It would be very difficult to do comparative studies, and it would be very embarrassing, I think, for the patented medicines, especially all the progestins which sadly are considered in the progesterone category, though technically there can be arguments made against that, and definitely for the estrogens. The bioidentical estrogen, I personally believe you should never ever put anything else in your body other than bioidentical progesterone or bioidentical estrogen. Estrogen or progesterone, period. And that's my belief. But if you need something, and you can always have various be on a various detoxification protocol and alkalization protocol to help get rid of that. In terms of men, you have what's called andropause, and basically this is the grumpy old man syndrome, where your get up and go has got up and gone or went. It's movedon.com. And symptoms often, are denied by the patient and definitely unrecognized by the physician. I'll give you an example. Guy comes in and says, "Hey, could you check my testosterone?" He read Men's Health magazine or one of these other great websites that talk about men's health, and they're like, "Wow, I have 9 of these 10 symptoms that they're talking about for low testosterone." And so the doctor draws a total testosterone. It comes back, it's 400, 375. The doctor says, "Oh, you're fine." Well, wait a second. You might not always be fine. If your numbers are 400, 500, even 600, that might be good if you're 90 years old. That might be great if you're 90. But typically, you're a healthy, active man with a total testosterone of less than 700, even 750. Many times you'll still see symptoms. So you can be symptomatic, but the statistical calculation for the norm for the reference range on this lab data, you're in that statistical norm, but yet you have all these symptoms. The reason is because the body can convert testosterone, your free testosterone, into cortisol, and then you've got a good total. Your free is low, and you're totally symptomatic. You have very bad andropause. And let me tell you something. This is happening with men younger and younger and younger. I'm getting men in their 20s that are coming in with a free testosterone in the low 400s, sometimes high 300s, and they're for their total, and their free testosterone is 9. And I say, well, look, and they say, but that's in the normal range. And I'm like, well, look at your estradiol level. Okay, that's 19. And your free test is 9. So, that's what your wife or your sister has right now. Okay, that's her hormone profile. And that shouldn't be yours. It should be the opposite. Your free testosterone should be in the 20s, even 30s. Even high teens is good. And your estrogen should be, in the single digits or very, very low teens. And that's when your profile is looking good, and the symptoms: erectile dysfunction, decreased strength, night sweats, low sex drive, irritability, thinning hair. Your get up and go has got up and gone. Weight gain, abdominal weight gain. That's when these symptoms are gone. And let me tell you something else too. If you have low testosterone and you have these symptoms, then chances are you have a strong chance of having a thyroid issue, a subclinical hypothyroidism. You can have adrenal fatigue. You can have all three. Because once your body starts converting testosterone into cortisol, it's because you have adrenal fatigue. And if you have adrenal fatigue for a year or longer, for most men, you're going to have some degree of thyroid dysfunction. And that means that your thyroid numbers can come back normal, but you're symptomatic. Your thyroid has been under stress for too long, and it needs certain coenzymes and minerals and things to perk it back up and to get it running again. You definitely need certain vitamins and minerals and coenzymes and so on and so forth to heal the adrenals, and then you need to replace your hormone. When you talk about replacement of hormone, for most men, especially the younger you are, the best route to go is bioidentical hormone replacement. If you're in your 50s and 60s, yes, injectable synthetic is fine because you're going to be on it for life, and you want to get often you want to get that supraphysiological level. because of comorbidities, certain toxicities and other things that can really be hard on the system if you start detoxifying, and you feel better when you have a little bit higher testosterone. That doesn't mean it would be as high as these people that are illegally doing testosterone in a gym or something. That's criminal, that's corrupt. No. That is a crime. I'm talking about getting your levels a bit above normal. That's going to help you feel better while you're detoxifying, and that's actually the range that you would keep your synthetic replacement hormone at. Typical for LabCorp, it's about 350 to 1190 for the total testosterone, and if people are on injectable testosterone, you're going to want that in the 1400s, even at 1500. That's just the way it is. But if you're doing bioidentical, you don't have to have it that high because it's not going to be reflected in a serum. You can measure it by the serum, but most of the medication is going to be in the tissue level. It's not going to be bound to proteins in the blood. And most of the free hormone, yes, you'll see it reflected on the lab result, but it's going to be actually in the tissue. And if you really wanted to understand the free level, probably a more accurate reference would be then going the saliva route. And of course, you have to have special training to understand saliva hormone testing. And basically, any primary care internal medicine physician, 99 times out of 100, I should probably say 999 times out of 1,000, they just haven't been exposed to that in their practice. That's just not what they do. This is a specialty thing. So that just helps give you an idea for bioidenticals. I've given you a little bit of an idea in some of the physiology of that. And so I call it the common sense replacement. If you need to replace your hormone, your testosterone, if you're a male, or in a female, if you're estrogen, progesterone, if you need to get that in balance, I think it's the common sense replacement. I think it's the place to start from. If it's missing or low, very specific doses can be given versus the supersaturation, of synthetics. Supersaturation, stuff is going to get ionized, in different tissues, because in different tissues you have different pH levels, which the pKa of a drug, which means at a certain pH, it will change. The drug will ionize or unionize, and then it gets trapped in that tissue. So you're not going to have that at all with bioidenticals, where you will with synthetic hormones. So it's a completely different medicine. It is a completely different therapy. There's a complete different understanding, and with bioidenticals, I call it the common sense replacement. So again, I am Matthew Peters. I'm the medical director for Potomac Rejuvenation Center. You can reach us at prcndc.com. We're conveniently located in Tacoma Park. It's right on the borderline with Tacoma Park, Maryland. We're on the DC side. And I look forward to meeting you. I hope you make an appointment. We do nutrition consults, nutrition for daily activity, nutrition for detoxification. I am an herbalist, and I also can put you on certain herbs for nutritional properties that they possess, which can increase your energy, can detoxify you, and can aid in the healing process as well as balancing your hormones. So I'd like to thank you for your time. Bye-bye.